Okay, sorry everyone for being a few minutes, 11 minutes late. We carried over from the last meeting some hot button topics there that we had to address. So I'm just going to race through this as quickly as I can. Again, thank you for being with us for this October 21st briefing. Sorry to report 2 more additional deaths as we reach 157 related to COVID-19. Our numbers, total cases 10,918. You can still see that 20 to 29 range is leading the way as positive tests. But the Latinx and Hispanic population continues to account for half of the positive cases. The hospitalizations look great, lowest we've had in a long time, down to 18. And we hope to continue in that trend. Lots of ICU beds and acute beds available. We're approaching almost 200,000 tests. We're at 191, on our way to 192 here, and that's just a tremendous amount of testing going on in the county. We'll talk a little bit about that very quickly. The thing that's remarkable also is the hospitalizations and the deaths for the long-term care facilities has really stabilized. A credit to health and all they're doing there. Also, so last week we had about 4,900 total individuals at the event center. I'm sorry, in our Verily testing, that's 3,094 at the event center, 1,800 at the mobile sites. The event center is still processing great numbers, but we have not reached our capacity any day of the week. Last week, again, they're open Tuesdays through Saturdays, 8 a.m. to 3 p.m. They still have a lot of capacity, so we want every spot filled if we can, and that really is helping us push towards that orange tier, and we'll get into that also. Testing update, as you many may know, we launched yesterday the dedicated kids and family curative lane at the event center. It went fantastic. We had 394 individuals go through that line. And that is a line that can hold up to 500. So we even have capacity there. That is open Monday through Friday from 1 p.m. to 8 p.m. so that we can accommodate families after work. And we'd love to see that filled every day. And just what I've heard, it went terrific. People sailed through, very easy process, very organized. So we encourage people to go out and take advantage of that. Let's see. So at this point, I got to say the county was really exceeding our testing capacity, our testing goals that we set when we first heard about the blueprint for a safer economy back in September. And this is amazing. And I just want you to credit to the staff here and what they're doing. In just 6 weeks, we've increased our testing rate by more than 70%. By 70%, going from an average daily test of 1,800 tests to nearly 3,100. And we've got more planned on top of that. So we're at 3,100 tests per day, and that was as of the most recent report to the state. That does not take into consideration a new family lane that we have open for parents with kids. So we hope to increase that even more. And we're also obviously not only doing those set sites, but we're working with CBOs in our cities to do the pop-up locations. We're averaging 5 to 6 pop-up locations around the county a week, and we hope to add many more. So all that's good news, but a 70% increase in just a short period of time is terrific. We encourage people to go out, get tested on a regular basis if you're an essential services worker. It is easy, it is painless, and it is time well spent. Blueprint for a safer economy. The county metrics as of Tuesday, I think we heard some of this yesterday from Louise, or most of this yesterday from Louise. We are moving towards the permanent orange. We've spent 1 week in the orange now with the 7-day lag and the 7-day average metrics. We've made tremendous progress in a short period of time to get to that orange tier. And the adjusted case rate, as we know, was 3.5 per 100K versus 4.7 the week before on 10/13. The unadjusted rate is 4.7 versus 5.2. which represents a 24% decrease from last month. I mean, that's amazing. The positivity rate, 1.8 versus 2.5 on 10/13. That represents a 56% decrease in the last month, consisting with what's happening around the Bay Area. And the health equity metric, I'm really happy to report, is at 3.3 versus 4.8 on 10/13. And that, you remember, has to be at least 5.25 or below. So we're meeting that, we're exceeding that. For now, the county continues being assigned to the red, but we are optimistic, very optimistic, that the reporting for next week will put us in the orange. And of course, remember that that time period is already in the books, because what they'll be looking at was the week of October 11th through the 17th. So we certainly were increasing testing during that time frame, and that testing and the credits that you get for that testing are so important to moving through the tiers, and that is why we put such an emphasis on testing and put so much of our efforts in money into testing, quite frankly. We know that along with continuing to wear a mask, physically distancing, washing hands, and limiting the mixing are the keys to success in moving forward and staying away from a step backwards into the purple, or when we get to the orange, into the red. So as we continue the reopening process, County Health remains focused on assigning out all new positive cases to contact tracers, and they're doing very well at that. And also identifying that need extra support through the County's Mental Health Association MHA support program. The MHA support program has received more than 500 referrals since August 18th for wraparound services, and health estimates that more than 2,400 residents have received food support, medications, rental assistance, wage replacement, and other items and services needed to provide for successful isolation. So we will continue to expand on that as necessary. We want to make sure that those who need to isolate can avail themselves of those services in a way that they feel that their families will be taken care of, they'll receive their wages, and they can feel good about isolating and not getting their family sick. And we have many people in that situation in this county. The COVID-19 compliance team, as you all know, and the business engagement compliance program are up and running as of Monday. Really the purpose, and I just want to reiterate this, the purpose of the compliance team, which is part of the larger business engagement compliance program, is first to educate businesses and owners about how to comply with the state and local requirements. So we've got a team in this business engagement program that will go out, and we're going to go out to as many businesses as possible with toolkits and show them how that they can distance, socially distance, and operate in a meaningful way, in a way that's strategic, in a way that'll keep them open, keep their customers safe. And we put a lot of money into that effort. It's really all about education and efforts to keep them open and open more businesses and get more people back to work in this county. But for those we know, and certainly that's the carrot, that we'll be there to support them and help them and open in a safe way. But for those who do not, we will have the compliance team that will follow up, and they'll be going out and giving warnings. I can tell you that we've already received 80 complaints that they're working on, and they're going to go out there and educate and work with them to become compliant, and for those who are not. And certainly if they don't, we have the ability to issue administrative citations that will result in fines of $250 up to $3,000 per incident. So, and if that does not work, there's the next step would be a referral onto the DA's office. So the compliance team is out there, they're up and running, and they actually hit the ground running. After some training on Monday, they went out and they're out there now visiting businesses. The county assistance program, we've got total homeless served 186. The Great Plates program, we've got 2,975 participants, delivered over 764,000 meals to date, 69 active restaurants. You know it will be up through November 8th, but the county will then pick that up if the state fails to after that. The Small Business Owner Assistance Program is up and running. That program opened applications October 15th. To date, we've had 65 applications that have been initiated with 15 submitted. Program facts can be found at www.smcstrong.org/small property owner grant. To better help residents apply for the assistance for the grant program, the county staff is currently working on an application checklist because we have found that some of the applicants are leaving information out. So we want to put together this checklist, and we encourage people to occur. This is a good thing. We've got the money there for these smaller landlords who have suffered because of COVID-19. And again, it will also help alleviate the debt and the burden of the unpaid rent of the renter. So very important that we get the word out and get people to apply. Just really quickly, I think a lot of you know these things already. October 20th, the Board of Supervisors, COVID-19 actions, $3.5 million of CARES funding to expand high-speed internet access. That'll mostly be in Daly City, South San Francisco, and San Mateo. We had that beta test in La Honda and Pescadero and East Palo Alto and Ravenswood, North Fair Oaks and Sequoia, and that's going very well. We're getting those connections up and running right now. And so we've got the blueprint that we now feel that we can move to other parts of the county. The board also gave $2 million in CARES Act funding for the second harvest, and they've just done a great job. They've been great partners, but lots of need, and hopefully that'll help fulfill some of that need. $2.5 million in CARES funds for the Renaissance Entrepreneurship Center for small businesses, really working on small businesses. That is so important to this community, really an essential part of this community. So many small businesses out there now who are hurting and who were just getting by in many cases before COVID-19. And this has been a crushing blow to them. We want to get them back up and running. We want to get their employees back to work. And this money certainly will come back to the county in a variety of ways once we have these businesses open and employees working and people using their services. So a great funding opportunity by the board, which they've taken advantage of, and that money will be out there shortly. $2.5 million additional Measure K funds for the Immigrant Relief Fund that will allow additional grants of up to $1,000 for 2,000 additional residents. Just to give you an idea there, the amazing need with 23,000 applications with 10,394 grants approved. When the new funding is added, the previous $2 million contribution, the $5 million given by Sombrato Foundation, and the $4.1 million raised from the philanthropic groups, it'll total more than $13 million to help 13,000 low-income San Mateo County families. That's just amazing. On to Census. We have retained the #1 spot in the state at 78.5 self-response rate. That is something we're very proud of. We set out to be #1. We got it early and we maintained it. Just a credit to all the cities and CBOs and partners who have worked on this for so long. We had hoped it would go longer, at least through the end of the month, but that was not the case. The Mass Mobile, we're going to get the schedule of that up and out to the public so that they will know where to find masks, but they've distributed over 12,000 masks countywide so far. And we're going to certainly be partnering with food distribution sites to get more masks out. And just to let you know, so the meeting schedule, we're going to go to every 2 weeks now. It's been wonderful, but we want to try to move as much back to normal as possible. We don't see the information coming in on at one point it was a daily basis. Things were changing, and then certainly we did, I think, 3 times a week, and then 2 times a week, and then every other week, and now and then every week, and now I think it's time to go to every other week. So with that, certainly happy to answer any questions you might have.
If you have any questions, please use the raise your hand feature on Zoom or type a question into the chat. We have a question from Sierra Lopez. We've seen a slight uptick in positive cases among children. Is this a concern for officials? And is there any reason to, any relation to some schools beginning to convene in-person classes?
Yeah, I don't see that as a case, but Sarija, do you have any thoughts?
Overall, kids have not been a highly tested group in the earlier weeks and months of the pandemic. And as testing has become more available, including our own testing that Mike talked about, and a separate lane for kids who need access to a test, we do see the ability to find more cases. And at this point, we don't have significant concerns among the pediatric population, but encourage any family who needs a test for a child, go through your healthcare provider, your pediatrician, or avail yourself of the lane that the county is making available.
There was a follow-up to that question, which was, as some schools begin to offer in-person classes, will there be consideration for expanding testing beyond 500 a day? And how frequently should parents have their children tested if returning to in-person classes?
Let me take the first part of that. We can certainly expand that. If we see the need there, we will take a look at expanding that. But, the school districts are also working on their own testing. So that will be, I think, forthcoming as they get further into the development of opening. But Sarija, do you want to talk about the other part of it?
Yeah, the public health officials have not relayed a specific cadence recommendation for kids. For school faculty and staff, the recommendation is to be tested monthly. And then for a child, if there's any exposure, if there's symptoms, that would guide you about regular testing of kids.
Great.
Again, if you have any questions, please use the raise hand function in Zoom or type it into the chat. At this point in time, we don't have any hands raised or question. Oh, we have a hand raised. Sierra, go ahead.
Hey, Sierra.
Hi, how are you, Mike?
Good.
That's great. I do have a question on potential changes for next week. I understand that we're shifting to 2-week pressers, but if we do end up shifting to the orange tier next Tuesday, as it looks like we may, will there be a presser next Wednesday or?
No, but you can always ask. I mean, you can always call in anytime, and we can accommodate any question you have, any interview you want. I mean, that goes without saying. Anytime you have a question, please call us.
Okay, great. And then I do have a quick question actually about Halloween coming up and trick-or-treating. We see some news around our conversation among parents that trick-or-treating might not be as dangerous or of high risk as health officials have warned. Is this of concern to the county? And what is kind of the health perspective on this? How risky really is it to take your kids out on Halloween?
Well, I'll start it, and then maybe Sarija can follow up, because we just heard Dr. Morrow talk about this. It's really the accompanying issues associated with trick-or-treating that need to be addressed, and that's the crowds gathering, the personal interaction with the kid and the homeowner, and parties and those type of things. To the extent that people want to leave candy outside and it's a family member walking around picking it up, and they use all precautions to do that, and there's not that face-to-face interaction. I mean, I think that's appropriate. They will leave candy on a table outside or something like that. But we're just really worried about the crowds gathering. And Sarija, do you have some more thoughts about that?
Yeah, and we really appreciate that families want to find ways to safely celebrate Halloween and bring joy to the household. Kudos to our Office of Community Affairs team that's developed some infographics in English, Spanish, and Chinese to assist with some safer options for Halloween. And we just do reinforce the state's guidance around how to safely celebrate. We want to protect each other. We want to make sure that there's lots of joy and well-being.
And we want to make sure we don't slide backwards after Halloween.
Great. We have two hands up right now. We have Astrid, and then we'll go to Henrietta. Astrid? if you can unmute yourself.
Hi.
Astrid?
Hi, Mike. Hope you're well. Quick question. Two or three questions. Just to confirm, is this the first week that we're meeting the criteria for the orange tier? Is that correct?
This is the first week that we are in the orange tier.
Or meeting the criteria for it?
Yeah, that we're getting credit for it. That's a very good point. We're getting credit for it. So they'll be looking at our past week to see if we can, and we're reporting out on that Tuesday, next Tuesday, to see if we're in the solidly in the orange tier and can move to the orange tier opening status.
Okay, got it. And then with respect to the compliance unit, were those 80 complaints that you mentioned, are those 80 complaints since Monday or just in general since that complaint form has been on the website?
I think that the majority of them have come in since Monday, but we had some prior to that. So they're a combination of the previous ones and new ones. And we're just happy that the system's working, that people have a way to report. But again, it's all about making sure that we educate the owners and make sure that they comply with the guidelines and regulations that are in place from the state and the county.
Got it. And then do you have a sense of what types of businesses are in those 80 complaints?
I think, some of them are around gyms, as far as jiu-jitsu and karate and those type of things. And I think some are around restaurants. I think they're really across the board in a variety of things, some retail. We've seen a little bit of everything, really. So, and again, just because people are complaining, they may not know what the regulations are, and these businesses may be absolutely in compliance, but that's what the unit's there for, to go out and see. And they have started visiting businesses as of yesterday, to go out and make sure that people are compliant, or at least they know what they have to do to comply. And they very well may be in compliance, and the consumer didn't know that.
Okay, got it. Thank you.
Absolutely.
Thanks. And now we have Henrietta. Henrietta, if you want to unmute yourself.
Yes, thanks so much. I just wanted to confirm that the next meeting with you would be on November 4th after the election.
That will be a very interesting day. Yes, November 4th.
I'm thinking there's just going to be so much going on to talk about. So will your comments include the effects that any of the election issues might have on the county and your department?
Well, that's interesting. I mean, to the extent that we know how that will impact the county, I'm not sure. But Henrietta, I always like to try to accommodate you. So if there's a way to do that in a way that makes sense, I'm happy to do that. And if you have some specific questions ahead of time, like earlier in the day, that we can answer, I'd be happy to try to do that.
Okay. I just wanted to confirm that our next meeting will be on that day.
It'll be a very interesting day. Absolutely.
Thank you.
And we have one more hand up from Sierra.
Yes, Sierra.
Hi, yeah, I wanted to follow up on Astrid's question. You said that the task force started going out yesterday. Is there any information on any findings of validity available?
I don't have that. But it would just be, and I think what you're getting at is how many businesses were not compliant as opposed to compliant. Yeah, I don't know, to tell you the truth. So we can maybe look into more of that information for the next time we speak. And I think we'll have a lot more data to report out on at that point in time.
Okay, that'd be great. Thank you so much.
You got it. Okay, everyone. Thank you. Stay safe. We will see you in 2 weeks, November 4th. Take care.